So what makes Mattapan Community Health Center different, and why the Community Health Center model is a good model for the rest of the United States, is the fact that we're able to deliver health care to where people are. And not only that, we're able to tailor our services to the needs of the community here in Mattapan. Many of our healthcare workers here at the health center live in the community. Many of the providers here have close friends in the community and also live in the community. And it gives that sense of comfort to folks in the community, knowing that they can come to a place where not only will their health ailments be understood, but also where they and their culture will also be understood. We are very proud of the fact that we have many services here, and that our providers work very hard to make sure that those services are integrated in terms of a patient care. Meaning someone could walk through the door of Mattapan and be assessed, and that assessment may determine that this patient needs dental work, mammogram, needs blood work. She may have a daughter who just got pregnant and may need to be introduced to WIC services. So much of that assessment comes at the very first visit here, where we're able to see what resources we have available for every patient that walks through the door. So what we find at the health center is, again, we can't do everything at the health center. So we have partnered with many community-based resources around Mattapan and Hyde Park and Dorchester to use as referral points for those patients who would benefit from more intensive care. One example could be a community-based resource whose sole purpose it is to keep adolescent patients with type 1 diabetes out of the hospital. So we know that patients in this community have a higher degree of depression, and that depression may lead to poor outcomes in terms of their diabetic control. What this community-based resources would do is, if I identify a patient, an adolescent, who would benefit from this resource, I could refer them to this resource. They would come visit this patient in a home, assess his or her knowledge about diabetes, watch this patient give himself insulin, and also call this patient on a daily basis to make sure that he is not only checking his blood sugar, but also giving himself the right amount of insulin. So that's extremely important in terms of helping this patient understand his or her own disease process, but it's also important to the healthcare system in general, because it helps cut down on unnecessary healthcare utilization, hospital readmissions, those sorts of things.